It's me, Professor Sugar again. And today what I'm going to discuss about is a very important topic to understand, and that is the beliefs and conceptions of knowledge, learning, teaching and examination. What are the beliefs at this point of time in the world or previously, and what are the conceptions about what knowledge is, about teaching, learning and examination? There are two words which are important. One is belief, other is conception. Belief is something that is considered to be true or held as an opinion. The important thing is, as you also know, belief is considered to be true or it is an opinion which is held by someone. That is belief. Similarly, concept or conception is general idea about something. So what about knowledge? So therefore, beliefs may be true or false. As you can recall, belief is an opinion of someone about some information or something. It may be true or it may be false. Once it is established by evidence that a belief is true, then that overlapping belief is called knowledge. A beautiful definition by Mr. Alman. The important thing is, evidence that a belief is true, evidence that an opinion is true, evidence that an information is true, then that becomes the knowledge. And in fact, to medical students, we teach two things. There are three domains of learning: knowledge, skills and attitudes. So therefore, we teach them only that information, only that opinion in best evident medical science that has been established by evidence to be true. As far as a learner is concerned, there is perspectives about knowledge that differ. Those learners who have dualistic perspective, they view knowledge as either right or wrong, because we have said that knowledge is that belief which is based on evidence. So they believe knowledge is either right or wrong. They believe knowledge to be certain and absolute. Either there is knowledge of something, there is not a knowledge of something. But as the mind of a human being develops and learner thinking process gets maturity, then he develops a relativistic perspective. Learner views knowledge as uncertain and relative, not certain and absolute. So therefore, now he tends to value more the knowledge of other. He tends to value more when evidence is presented to him about an information which differs, reaching to different conclusions, as is occurring in research nowadays. Third is relativist and constructive perspective. Learners view knowledge as uncertain and relative, but fluid, changing and contextual, and it has to be individually constructed upon pre-existing knowledge. So a learner or student with this perspective believes that whatever knowledge is, one more important element is it is contextual. Number two, it depends upon the previous experiences of individual learner, on which he puts some new knowledge and new information to develop his schemas and so on and so forth. What is learning then? The ideas about conception of learning is that learning could be simply memorizing, or it could be acquiring facts and skills or procedures which can be used, or understanding and making meaning of information. You could memorize that one may acquire facts and skills, but not only acquire facts and skills, the purpose is those facts and skills are required which can be put to use. Then understanding and making meaning of information, so that once you have understanding of the information and you understand the meaning of information in different contexts, then interpreting the understanding in the reality and using it in different contexts. Mind you, this all is learning, but obviously this is better learning than simple rote memorization. And this is what we want in medical students. Whatever knowledge they get, whatever information they get, they should understand it, they should know the meaning of it, and they should be able to apply it in different contexts. Because when the patients come, the contexts differ. What about approaches or conceptions of learner in learning? If you talk about the type of learners, broadly speaking, there are active learners and there are passive learners. There are students who learn actively and there are students who learn passively. An active learner student actively participates in a learning experience. That learning experience could be any. The passive learner does not actively participate in a learning experience. Just to give you an example to understand this thing, you see, setting of learning experience could be a lecture, practical, hospital teaching, or he is studying alone. It doesn't matter. It means he is trying actively, he is attentive to understand, ask questions when he is confused, constantly the queries like what, how, why, how to apply it, what benefit it will give, how that will help the patient are coming in his mind consciously or unconsciously. If you see this thing, so therefore the student who is an active learner is going to be a better student than a passive learner. A better doctor would be an active learner and a lesser doctor would be a passive learner. In a medical school, the intention of learner could be different. Those who have surface approach to learning and there is a deep approach to learning. So there are two approaches and in both the intention is different. In fact, there are three approaches and third I am going to tell you later on, which is a strategic approach. In all three, the intention of the student is different to learn. In surface approach, and the intention of student here is to duplicate what they have learned to pass. So intention is to pass. During studying, the emphasis on rote learning and not understanding the information. Whereas in deep approach, the intention of student here is to understand the study material and not merely to pass. Because if you understand the material, obviously he is going to pass. Students interact with the content by relating the content they are studying to their previous knowledge and experience, thus resulting in meaningful experience. Coming back to the previous slide, it means if the active learners, they will have a deep approach to learning and passive learners will have surface approach to learning. Then in a strategic approach, the student practices both deep approach and both surface approach because they want to score more, at the same time they want to understand. So whatever the content in a course they have to study, they are intelligent enough to use their mind or take opinion from the resources available to her to divide the content into two portions. One, they are going to study it by surface approach. One, they are going to understand it deeply. That is called a strategic approach to learning. What about teacher and teaching? So the approaches of teaching could be closed teaching, which is done by traditional teachers, or open teaching by non-traditional teacher. Let me give you an example. In closed teaching by traditional teacher, the teacher assumes the students know nothing. This is a slate, blank slate. So therefore, the responsibility of teacher to transmit the knowledge to the student. The teacher decides what, how much, and when to teach. We all have experienced some point of time in our life such teachers also. In open teaching by non-traditional teacher, the teacher facilitates the learning of the student. We have experienced these teachers also. From perspective's point of view, open teaching by non-traditional teacher is much better than closed teaching by a traditional teacher. Just to clarify this thing, what will be going on in the mind of the teacher? Now, if the intention of the teacher is, I feel it is important to present a lot of facts in the classes so the student know what they have to learn for this subject. And such a teacher, his plan of action of teaching or strategy would be, I design my teaching in this subject with the assumption that most of the students have very little useful knowledge of the topics to be covered. Which type of teacher it would be? It's a traditional teacher who will try to practice closed teaching. What about this? I feel a lot of teaching time in this subject should be used to question students' ideas. And he plans like this. In my class, for this subject, I try to develop a conversation with the students about the topics we are studying, and in that process, students are learning. This is open method by a non-traditional teacher, which nowadays we call facilitator also, if he is doing this job. Then there are approaches to the educational strategies. In a medical school, what is the plan of action by which the students are taught? There could be a teacher-centered approach and student-centered approach. When we are talking about teacher-centered approach, we are talking, in fact, is something about traditional teaching method, closed method, as we have, and passive learning. If you are following the previous slides, the teacher is the key figure, and there is an emphasis on formal lectures or laboratories. Whereas in student-centered approach, the students take more responsibility for the learning and emphasis on students and what and how they learn. If you think of it, this is a continuum, rather these are the continuums, and there are two extremes which we are discussing, and somebody is going to fall in between. This is the left side, this is the right side. Somebody could be on far right, somebody could be in the far left, or in the middle, right or left. Just to give you an example of student-centered approach, and we are talking it an ideal situation, and ideals do not exist. Students studying physiology receive a set of learning objectives which outlines both the minimum requirement of the course and these areas they can study in depth. Students study the subject individually from the printed material or programmed tapes like presentation. The students can choose to use the material at a time suitable to them and can take as long or short a time they wish to study any program. At any stage, they can refer to standard textbooks or the member of the faculty. The students carry out practical exercises at the time most appropriate to their study of the subject. And when they feel they have mastered a phase of course, the faculty arranges for examination. Mind you, this I am talking about the far left side of this continuum. Very teacher-centered approach. Students in physiology have 4 lectures, 1 practical class. To learn, student must attend the lectures. The laboratory work is based on a manual prepared by the faculty. A student is given little opportunity or encouragement to study the subject in depth. Let us say about 10% of class fail at the end of the course examination. They have to resit the examination 3 months later. Feedback on the examination result is not provided, nor will they receive help in their study technique. Therefore, an institutional medical school could be in between, on the far right side or the far left side, or in the middle of these 2 continuums. Then, how the information is given to the student? It could be information gathering approach, which is also called as knowledge gathering approach, or problem-based approach. In information gathering approach, the emphasis is on formal lecture and laboratory, in which the knowledge or the information is imparted to the students. Whereas in problem-based approach, it is based upon problem solving to develop a usable body of integrated knowledge and problem solving skills. One of the methods in medical sciences which is used when problem-based approach is used is problem-based learning, which is a method of teaching. Then another approach which medical schools try is discipline-based or subject-based approach or integrated approach. The subject-based approach centers around focus on classical coursework such as anatomy, physiology, with clinical care coming later in the program. Classical medical schools, pre-clinical years, clinical years, in pre-clinical years, no exposure to clinical material and vice versa. This integrated approach, the organization of teaching matter to interrelate content of subjects taught in different academic courses or departments. Integrated approach. There are 13 subjects, as we know in the medical colleges or medical schools usually. So knowledge of all the subject is fused, the fusion around the systems or organs or clinical presentations of the body. And then when it's given to the students can learn much better, they can correlate much better, because the patient which is going to come to them is not going to come a patient of a system, patient of an organ, patient of a subject. The human body is a fusion of all of these things. Then there are 2 approaches where students should be taught. In hospital-based approach, focuses teaching within the main teaching hospital, which are tertiary care hospitals usually. Whereas community-based approach allows students to receive their training in a community setting, that may be a general practice clinic, family home, family planning clinic, or a rural hospital, etc. And there is a difference. The patients who come with diseases in tertiary care hospital, they are different. In primary community care, they are different. The specialists which are treating them, they are different. They are super specialists there, and they are general practitioners there. The approach to patient is different. Examination, there are 2 types approaches to examination. Either the testing tests the recall ability of the student, or problem solving ability of the student. And when problem solving ability of the student is tested, obviously recall comes automatically behind that. Disaster in a medical school if curriculum is traditional, teacher-centered, knowledge gathering, subject-based, non-integrated in the classroom setting. So therefore, obviously, the teaching is going to be closed and traditional. Student and teacher using superficial approach to learn, examination questions predominantly testing recall. At the end of the day, You have a graduate doctor with a certification degree from a university, but it cannot solve the problem of the patient. That is a tragedy, that's a disaster. So therefore, if proper things are chosen, like student-centered problem-based integrated curriculum, with an open method of teaching, with teachers which act as facilitators, students are deeply learning, student-centered, and questions which are taking problem-solving, then you will get a doctor who's going to solve the problem. Why I have discussed everything is because this will convert the dependent learner into a self-directed learner. Students will going to learn professionalism also. If you see this relationship model of teaching and learning by Prosser and Tribble, it is very interesting. Everything is interrelated. Everything is webbed and connected. One thing has an effect on the other. We talk about curriculum, learning design, course design, assessment, learning environment. We talk about student, characteristic of learner, using surface approach or deep approach, active learner or passive learner, characteristic of teacher. Does he act as a facilitator or is a traditional, closed teaching teacher? What about the student perception of the context? What are the teacher's perception of the context? What are the teacher's perception about the knowledge, student perception about the knowledge, etc.? Then obviously the approaches to learning, and this web is so interrelated with each other. If you change one thing, it affects each and everything. In fact, at the end, if you change anything, it affects multiple things, and the outcome or competencies which you wish your medical school student should have, they will not have. I hope you find this discussion useful. Have a good day, enjoy sweet moments, see you again.